Yeah. Vaginal laxity is the definition of when there is loss of tonicity on the vaginal wall, and you have got loose opening of the vagina, plus deficiency of the connective tissue and pelvic floor muscles around the vagina. Usually, the main cause is after childbirth due to overstretch, mechanical overstretch, and birth injuries, ill-healed scars, and also due to hormonal changes. Also, it can happen after the menopause due to loss of estrogen hormone that really keeps the strength or youthfulness of the tissues. Yeah, the symptoms of vaginal laxity due to it happen because of the loss of the support of the vaginal wall and the pelvic floor muscles. So you would expect you will have stress urinary incontinence, which is leakage of urine on jumping, laughing, running, um, even coughing. Will have bladder urgency. She feels that she needs to go to the more often to empty the bladder. Loss of sensation in the vagina, reduced sensitivity, which leads to sexual dissatisfaction, orgasmic dysfunction, and sometimes fecal urgency or fecal incontinence. Later on in life, you have sagging of the vaginal wall, prolapse, so it has to be treated very early as it should be. Yeah, effect of aging beside um, the loss of estrogen hormone um, happens that vaginal relaxation syndrome, which I explained about it, and there are other things like vulvovaginal atrophy. There is shortening or narrowing of the vaginal wall, narrowing of the opening of the vagina, contraction and loss of sensitivity of the clitoral body. You'll have the outer labia majora or the outer lips become flattened, parted, shrunk in size. You'll have loss of collagen and elastin fibers, thinning of the lining of the vaginal wall, loss of the normal flora of the vagina, what's called lactobacilli. So there is an increased predisposition for infection and reduced of the blood flow in general and reduced hyaluronic acid content in the area. So all these will cause really narrowing of and contraction and distortion of the tissues in this area, makes uh, really life quality of life is difficult. Like the lady will have dryness of the vagina, itching, burning sensation, dyspareunia, which is pain during intercourse, increase urinary problem like dysuria, increased frequency, all of that, what's called genitourinary syndrome or atrophy, vulvovaginal atrophy. This happens because of loss of estrogen level, declining in estrogen levels, and also in certain allied conditions like, for example, post-chemo, radiotherapy, sometimes post-surgery, and some skin degeneration diseases like lichen sclerosis. The treatment of vaginal laxity syndrome ranges between conservative treatment option like estrogen cream and pelvic floor exercises, which it has got its limitation and not suitable for every lady. Or the second option in NHS, for example, where I work, is surgery. Surgery has got excellent result. However, it's invasive procedure and expenses and has got long recovery time and also have got inherent risks for complication like injury to surrounding structures, bleeding, infection. The results vary from surgeon to another, and also the outcome is not sustainable. So after 2 or 3 years, the problem recurs, laxity. The new popular or increasingly popular option now is the medical subspecialty called non-surgical procedure, what's called vaginal rejuvenation, that relies on natural or non-surgical ways like energy-based devices or plasma injections. It is really brilliant in the hand of experts, because it is non-invasive, doesn't require any analgesia or minimal or little downtime. It calls lunchtime procedure, and within the hand of the expert, excellent successful results can happen without any complication. It should be done by trained doctors. The non-doctors, there is a liability of complications really high. Like, for example, one of the energy-based devices we use, laser, radio frequency, HIFU, etc., etc. These can cause burns of the vaginal wall, and fistula, which is a tract between the vagina and the bladder, severe inflammation and contraction of the vaginal walls. Really has to be a gynecologist, preferably, or well-trained doctor to use these devices. It can cause problems. My advice is to look after yourself and go to the experienced doctor who is well-trained and highly qualified to do this.